This is the University of Hawaii Maui College, the college on Maui.
So I'm going to go over some drugs and see if you can think in your mind about what these drugs do. And we'll start with acetaminophen, Tylenol. In other countries they call it paracetamol. And it's abbreviated APAP, AP. And you should know what acetaminophen does. Acetaminophen prevents prostaglandin synthesis. Prostaglandin is a type of chemical, and it's made in the hypothalamic heat regulation centers. There's a place in the base of your brain that helps regulate your body temperature. And so acetaminophen prevents prostaglandin synthesis in the hypothalamic heat regulation centers. And by preventing this prostaglandin synthesis, it prevents the brain from convincing the body to increase its temperature. And so acetaminophen is an antipyretic. Pyresis is temperature, like pyro is fire. And so antipyretic is something that lowers fever, lowers temperature. And because acetaminophen prevents prostaglandin synthesis as well in peripheral nerves, and in peripheral nerves that carry pain, acetaminophen is a painkiller, an analgesic. And this is a favorite trick question on board, so I'll tell you now. Acetaminophen does not have anti-inflammatory properties. So acetaminophen is not considered a non-steroidal anti-inflammatory drug. Ibuprofen and naproxen, those are NSAIDs. Aspirin, that's kind of an NSAID. Acetaminophen is not an NSAID, and I'm sure there's a board question somewhere that's going to try to fool you into believing that it is not. However, and this is what's most important to know about Tylenol acetaminophen, is that it is hepatically metabolized. It's metabolized by the liver. And if acetaminophen is taken in excessive doses, then the liver begins to process the acetaminophen in a way that is toxic to the liver. And so this is important to know. People who have liver disease, liver toxicity, for one reason or the other, they should not be taking acetaminophen. And that's also a favorite board question. Acetaminophen that's taken excessively can and will result in liver toxicity. But otherwise, it's considered relatively safe in pregnancy, a Category B drug. Pregnancy Category A drugs are the safest. B, they're pretty sure they're pretty safe. C, they're not real sure. D is considered unsafe in pregnancy. Pregnancy Category X is considered completely unsafe and contraindicated in pregnancy. And acetaminophen, according to wherever I got this slide, is contraindicated in people with hypersensitivity to tartrazine, which is yellow dye, number 5, something I forget until I look at this slide. So let's talk about acetylcysteine, acetadote, mucomyst, and this is very important to know about as well. Acetylcysteine is the antidote for acetaminophen toxicity, and so somebody who has taken excessive dose or received excessive doses of acetaminophen and are acetaminophen toxic, acetylcysteine will help prevent liver toxicity. So we'll use acetylcysteine as the antidote for acetaminophen toxicity. Something else acetylcysteine is used for is to break up thick bronchial secretions. So somebody with severe pneumonia or severe bronchial secretions, for whatever reason, we can use it as a mucolytic to break up mucus and help clear their airways. It's also considered relatively safe in pregnancy, a Category B drug. Acetazolamide, Diamox. Acetazolamide is a carbonic anhydrase inhibitor. And so it is also based on the sulfonamide drugs. And do you remember what carbonic anhydrase inhibitors do? We describe them as diuretics, but we really don't use them too much as diuretics. The sulfonamides were the original antibiotics, and a lot of people are allergic to sulfa drugs and sulfonamides, and so all sorts of drugs have been developed from the original sulfonamides. So acetazolamide, even though you'll see it described as a diuretic, we use it to lower intraocular pressure inside of the eyes, because acetazolamide prevents the production of vitreous humor. And so we use this in the treatment of glaucoma. Glaucoma is high pressures inside of the eye. And so we also use it to lower intracranial pressure. And so we will use that in something called pseudotumor cerebri, idiopathic intracranial hypertension. If it says normal pressure hydrocephalus, you can put pseudotumor cerebri, idiopathic intracranial hypertension. And acetazolamide prevents the absorption, the resorption of water, sodium, potassium bicarbonate in the proximal tubule of the nephron, and that's why it's historically described as a diuretic. The risks with using acetazolamide are seizure, pancytopenia, pan everything, cyto, cell, penia, too few, and so it's a type of anemia where there's just too few of all the cells of the blood. And then Stevens-Johnson syndrome is a risk with any sulfonamide-based drug. Stevens-Johnson syndrome is a severe reaction of the skin, amongst other things, that can occur with any type of drug and any type of disease process, but sulfonamides are especially notorious for Stevens-Johnson syndrome. If you don't know what that is, you should Google it and read about it. And because acetazolamide interferes with bicarbonate production, then metabolic acidosis is a risk with the use of acetazolamide. It's considered a pregnancy category C drug. Acyclovir is Zovirax. Acyclovir is an acyclic purine nucleoside analog. Basically, it interferes with DNA synthesis. And so it's available PO and IV, and it's used in herpes simplex 1 and 2, herpes zoster, and it can also be used to treat cytomegalovirus. They don't really recommend the topical form anymore for any of this. And so it's an antiviral. I think I just said this, used in herpes simplex 1 and 2, herpes zoster, and cytomegalovirus. It's always nice to have an extra slide. And so one of the risks with acyclovir is seizure, nausea and vomiting, thrombocytopenic purpurea, and hemolytic uremic syndrome. But it is considered relatively safe otherwise in pregnancy, a category B drug. Adenosine, Adenocard. Adenosine is an endogenous nucleotide which slows conduction through the AV node of the heart, the atrioventricular node of the heart. And because it slows conduction, we can use it as an antidysrhythmic for paroxysmal supraventricular tachycardia. And so we give this IV in the treatment of PSVT. And one of the risks that scares everyone in the room is that it will stop the heartbeat for 10 very long seconds. But they assure us the rhythm always returns, and that's always been my experience as well. However, we do not want to use it in high atrioventricular block, atrial flutter, or atrial fib. It doesn't work so well for that. And it's considered a pregnancy category C drug. But once again, we always have to weigh risk and benefit. In a pregnant woman's in paroxysmal supraventricular tachycardia, then there is possible harm going on, and it makes sense we would use adenosine in that situation. Albuterol is Proventil, Ventolin. So albuterol is an adrenergic beta-2 agonist, a sympathomimetic. Adrenergic meaning adrenal like adrenaline. And so the sympathetic nervous system, when the neurons secrete norepinephrine, or the adrenal pumps epinephrine into the blood, these adrenergic adrenergic receptors sense either the adrenaline or the norepinephrine coming from the nerve, and one of those types of receptors is beta. And beta 2 are in the lungs, dilating airways. Stimulating adrenergic beta 2 agonists will dilate airways. And because it mimics the sympathetic nervous system, it's considered a sympathomimetic. It's an inhaled bronchodilator. It's used in asthma and bronchoconstriction. That little yellow rescue inhaler has albuterol in it. However, because it's a beta agonist, it can speed up the heart rate, it can raise blood pressure, it can cause central nervous system stimulation, and it makes sense that beta blockers will block the effect. Beta blockers are commonly used in high blood pressure, and so since albuterol is a beta agonist, then beta blockers can interfere with the effect of albuterol. Tricyclic antidepressants, especially monoamine oxidase inhibitors and oxytocins, can increase the hypertension of albuterol. It's considered a pregnancy category C drug. Allopurinol is Xyloprim. Allopurinol is a xanthine oxidase inhibitor, and so we use it as an anti-gout medication because it decreases uric acid formation. Gout is thought to be caused by increased levels of uric acid and our inflammatory reactions to those uric acid crystals. And so if we can interfere with the production of uric acid, then we can decrease the prevalence of gout. However, agranulocytosis, not having enough granulocytes, jaundice, which is yellow of the skin due to liver failure, renal failure, are possible risks with allopurinol. And there is an increased risk of rash when it is used with penicillin. It's considered a pregnancy category C drug. Alprazolam is Xanax. Alprazolam is a benzodiazepine, and all benzodiazepines are GABA agonists. Gamma-aminobutyric acid, GABA, is a neurotransmitter that opens chloride channels in central nervous system interneurons. These interneurons provide, by opening chloride channels, we interfere with nerve conduction. That's why GABA agonists decrease neuron sensitivity, decrease neurotransmission in neurons, because opening chloride channels, chloride being the negative ion, completely offsets opening sodium channels, the sodium being a positive ion, and opening sodium channels excites the neuron membrane, so opening chloride channels negates the sodium from exciting the membrane. That's why they're called downers. And a more appropriate term is anxiolytic, meaning it relieves anxiety. And benzodiazepines can be used for all sorts of reasons besides anxiety, although alprazolam is used primarily for anxiety. However, there is a risk of CNS depression, central nervous system depression, with excessive doses to the point where the respiratory centers in the brain will completely lose their ability to control your breathing, and that can result in death. We also have to use caution in people who have liver insufficiency, hepatic insufficiency, because all benzodiazepines are heavily metabolized by the liver, and so people who have problems with liver metabolism, the metabolites of benzodiazepines can get high enough, especially in the elderly, and cause this first problem right here. And alprazolam is addictive, so addiction with all the benzodiazepines is a concern. It's considered relatively unsafe in pregnancy. It's a category D drug. Alteplase is TPA. So TPA stands for tissue plasminogen activator. It's a natural occurring substance made by the body that converts plasminogen in the thrombus to plasmin, and the bottom line is that it leads to thrombolysis, breakdown of the clot. So TPA, alteplase, is a clot-busting drug. However, your body is constantly plugging little holes, clotting blood for all sorts of reasons, for all sorts of good reasons. And so preventing that from happening can lead to hemorrhage. And it is contraindicated in recent stroke, recent surgery, cancer, and prolonged cardiopulmonary resuscitation. Amiodarone is Cordarone. Amiodarone is class 3 anti-arrhythmic, and it is used in advanced cardiac life support and is indicated in ventricular fibrillation, ventricular attack without a pulse. However, it's primarily used IV. However, the PO form, the oral form, if taken for a long time, can result in bluing of the skin. That's a popular board question. And pulmonary fibrosis, pulmonary scarring, lung scarring as well, is a possible risk with the long-term use of oral amiodarone. It's considered relatively unsafe in pregnancy, a category D drug. Amoxicillin clavulanate in combination is called Augmentin, and Augmentin is an oral medication. So amoxicillin with clavulanic acid, Augmentin, is a combination drug. Amoxicillin is the penicillin derivative. Penicillin is a bactam, beta-lactam antibiotic that is bacteriolytic, meaning it breaks down the bacteria. And clavulanic acid, clavulanate, prevents the bacteria from breaking down the amoxicillin. Bacteria make beta-lactamase, which can break down beta-lactam antibiotics. So the amoxicillin is used to treat and destroy the bacteria, and clavulanic acid, clavulanate, prevents the bacteria from destroying the amoxicillin. However, anaphylaxis, severe allergic reaction, is always a potential risk with penicillin, as is Stevens-Johnson syndrome. But it's considered relatively safe in pregnancy, category B drug. Ampicillin and sulbactam is almost the same drug. We call it Unison, and it's available IV. And again, ampicillin is a penicillin derivative, a beta-lactam antibiotic, which is bacteriolytic. And the sulbactam prevents the breakdown of the beta-lactam antibiotic by interfering with the bacteria's beta-lactamase. So the ampicillin is used to kill the bacteria, and the sulbactam is used to prevent the bacteria from destroying the ampicillin. Amphotericin B, fungizone. Amphotericin B is an amphoteric polyene, and it binds to membrane sterols, basically punching holes in the membrane, the wall of the fungus, and so that's why we use it as an antifungal. It's not only used in severe cases of fungal infections, it's also available in a topical form as well. However, with the IV form, there is a risk of hemorrhage, liver disease, liver failure, renal failure, and pancytopenia. Otherwise, it's considered relatively safe in pregnancy, a category B drug. Aspirin is abbreviated ASA, acetylsalicylic acid. Aspirin is also a prostaglandin synthesis inhibitor, and that's why it is an analgesic and and a platelet. Aspirin is prostaglandin synthesis inhibitor, and so it's an analgesic, and it's also an anti-inflammatory. So we consider aspirin to be a type of NSAID. Aspirin also interferes with platelet aggregation. That's why they talk about using aspirin every day to prevent heart attack and prevent stroke, to prevent the platelets from sticking together and causing heart attack and stroke. Aspirin does have antipyretic properties. However, it can cause something called Reye's syndrome in children with a fever. So do not use aspirin to treat fever in children, please. And so aspirin that is given immediately, aspirin is given immediately to heart attack victims in an emergency setting. Some people's standard of quality for myocardial infarction care in an emergency setting, whether that's the emergency room or in the squad, is how quickly we can identify the myocardial infarction and treat that person with an aspirin. Atenolol is tenormin. And atenolol is a cardioselective beta-adrenergic blocker. Cardioselective means it works really well on the beta receptors in the heart, but that does not mean it has no effect on the other beta receptors like in the lungs. And so don't be fooled by cardioselective. That means it has more of an effect on the heart, but there's still an effect on beta receptors like in the lungs. And so because it's a beta blocker, we use it to treat hypertension. Something to keep in mind is it is a negative chronotrope, chronotime trope, meaning to affect the body. And so chronotrope means it slows the heart rate down. However, in certain situations, it is a positive inotrope. It can increase the strength of the heartbeat. And so that's why, in certain cases, we'll use beta blockers in myocardial infarction. And that's also to decrease oxygen consumption by the heart. Anyway, atenolol is available orally and IV. However, one of the risks is its therapeutic extension, getting too much, working too well, low blood pressure, hypotension. All cardioselective beta blockers can result in bronchospasm, and so don't be fooled. And then pancytopenia is a very rare risk with atenolol as well. However, we do not want to use it in pregnant women. It is a Category D drug. Atorvastatin is Lipitor. And all the statins are HMG-CoA reductase inhibitors. HMG-CoA reductase is what your body and your liver uses to make cholesterol. And so by interfering with that enzyme, we can lower cholesterol. Atorvastatin, Lipitor, is very good at lowering triglycerides as well. However, rhabdomyolysis, meaning muscle breakdown to the point of clogging up your kidneys, is a risk with atorvastatin. Hepatotoxicity is not on this slide. That's always a risk with atorvastatin. And all the statins are absolutely contraindicated in pregnancy. They are Category X drugs. Atropine. Atropine is a belladonna alkaloid. Belladonna, beautiful woman, back in the Middle Ages, women would use belladonna alkaloids. They would put them in their eyes and dilate the eyes, and this is thought to have made them more attractive to men. And this is where the word belladonna alkaloid comes from. But atropine is an acetylcholine antagonist at muscarinic receptors. Therefore, it is a parasympatholytic. The parasympathetic nervous system, your rest and digest and relax system, uses acetylcholine at the organ junctions, and those receptors that sense the acetylcholine are muscarinic, and so that's why blocking those receptors is parasympatholytic. So we use atropine to increase heart rate. Remember, acetylcholine, parasympathetic nervous system, will slow heart rate down, so blocking that is going to increase heart rate. And so atropine is used in significant bradycardia. It's also dry secretions, and so we'll use that when we intubate during anesthesia. It's a mydriatic, causing mydriasis, dilates pupils. I think we talked about that. It's also used in acetylcholinesterase inhibitor toxicity. Acetylcholinesterase breaks down acetylcholine, so if we inhibit acetylcholinesterase, we end up with increased acetylcholine levels to the point of being toxic. So insecticides are acetylcholinesterase inhibitors, as well as military nerve gas. Something else that we can use atropine for, more commonly, is to decrease GI motility, and so the belladonna alkaloids and atropine will be in concoctions to decrease diarrhea. Azithromycin is one of the most popular antibiotics on earth. It's Zithromax. Azithromycin is a macrolide antibiotic. It is considered a 50S subunit inhibitor. The ribosomes that make proteins in bacteria are divided into a big subunit and a little subunit. The little one's 30S, the big one's 50S, and azithromycin, like all 50S subunit inhibitors, interfere with that ribosomal subunit, interfering with the bacteria's protein production. So azithromycin Zithromax is used for all sorts of reasons, including community-acquired pneumonia, mycoplasma pneumonia. It's used in chlamydia. It's available IV as well as PO. It's considered a relatively safe in pregnancy, category B drug. Benztropine is Cogentin. Benztropine is a tertiary amine, and we use it as an anticholinergic agent in Parkinson's disease. So it is considered an anti-Parkinsonian drug. It's available orally, IM, and IV. However, risks are paralytic ileus and hyperthermia, high temperatures. It's pregnancy category C drug. Bethanechol is uracoline. So bethanechol is an acetylcholine muscarinic agonist, and that makes it a parasympathomimetic. Acetylcholine is used by the parasympathetic nervous system, that rest and digest system, and so bethanechol is going to stimulate bowel function and stimulate bladder function as well. That's why it can be used post-operatively or postpartum after the delivery of a baby in the case of urinary retention. Sometimes the sympathetic nervous system is so stimulated that it slows the bowels and slows the bladder down to a complete stop, and we can stimulate the bladder and the bowels with bethanechol. So it's used in neurogenic bladder and paralytic ileus. Ileus meaning the bowels have slowed down to a near complete stop. However, the risk of any acetylcholine agonist is acute bronchospasm, hypotension, bradycardia, and low blood pressure to the point of no organ perfusion, which is shock. Bleomycin is Blenoxane. Bleomycin is an anti-neoplastic. Neoplasm meaning cancer, and so an anti-neoplastic is something we use to treat cancer. It is a polyketide antimicrobial, and the polyketides are derived from the bacteria Streptomyces verticillus. C, being a farmer, is important in the pharmacology business. It's considered cell cycle specific for the mitosis phase and the growth phase after DNA synthesis. And so some of the anti-cancer drugs are very specific for somewhere in the cell division, and bleomycin is specific between G2 and mitosis. But nausea and vomiting, stomatitis, and alopecia, hair loss, are risks and common occurrence with any cancer chemotherapeutic agent that interferes with DNA and cell reproduction. Food is always damaging your GI tract, and so that's why it is always busy making new cells. So it's always busy dividing rapidly. Your gastrointestinal tract does. And so cancer chemotherapeutic agents that interfere with cell division cause nausea and vomiting because your gastrointestinal tract is always rapidly reproducing the cells of the lining. Stomatitis means inflammation of the lips and the mouth, and the reason there's stomatitis is the same reason there's nausea and vomiting, because your mouth is part of your gastrointestinal tract. when it's not busy making words. Alopecia is hair loss. Your hair is constantly growing, and that requires a lot of cellular division for that to occur. And so keep in mind that the cancer chemotherapeutic agents that interfere with cell reproduction, the cytotoxic agents, are going to cause nausea and vomiting, stomatitis, and alopecia. But be sure and look that information up because that does not apply to all the drugs that we use to treat cancer. Buspirone is Buspar. Buspirone is a serotonin and dopamine receptor action. It has all sorts of mixed actions. The bottom line is we use it as an anxiolytic. And those of you who care for the elderly who have them on benzodiazepines for whatever reason, I'm sure you know that there's all sorts of people out there who would like you to at least try to substitute the benzodiazepines with another drug, and buspirone, Buspar, is an excellent choice to attempt to substitute benzodiazepines in the elderly. It's considered relatively safe in pregnancy. It's a category B drug. And I would throw this in, Buspirone, because I'm thinking about it, for this reason right here, is also helpful in irritable bowel syndrome. Captopril is Capitan. Captopril is an angiotensin-converting enzyme inhibitor. So it prevents the conversion of angiotensin 1 to angiotensin 2. And angiotensin 2 raises blood pressure. So preventing that lowers blood pressure. That's why we use it as an antihypertensive. We also use it in congestive heart failure. And something else to keep in mind is we use it in patients who have diabetes mellitus, a disorder of glucose regulation. We use ACE inhibitors even if they don't have high blood pressure, even if they don't have congestive heart failure. We will still give them ACE inhibitors to protect the kidneys from the damage that's caused by diabetes mellitus. So don't forget this part right here. Dry hacking coughs that won't go away. Captopril and any ACE inhibitor can be the cause of that. So when we start people on ACE inhibitors and they get this dry, irritating cough that doesn't seem to go away, sometimes we can try to take them off the ACE inhibitor and see if that makes it go away. And then edema of the ankles is also a potential problem with using any ACE inhibitor. We do not want to use it in pregnancy. They're considered a category D drug, especially after the second trimester of pregnancy. Carbamazepine is Tegretol. Carbamazepine is an anticonvulsant, meaning it prevents seizures. Its exact mechanism is unknown according to this slide, and so we use it as an anticonvulsant, and we can also use it to treat the pain of trigeminal neuralgia. Your trigeminal nerve, cranial nerve 5, senses the feelings from the skin in your face, and so neuralgia, nerve pain, is something that we can use anticonvulsants for. However, carbamazepine has a risk of Stevens-Johnson syndrome, aplastic anemia, where your bone marrow doesn't make enough blood cells, agranulocytosis, not enough granulocytes, and cytochrome P450. Those are enzymes in your liver that metabolize all sorts of things, including drugs. There can be interactions with carbamazepine and any other drug that's metabolized with the cytochrome P450 system. It's considered unsafe in pregnancy, a category D drug. The combination of carbidopa and levodopa is Sinemet. And so Sinemet, the combination of carbidopa and levodopa, levodopa is the precursor for dopamine. If you watched Awakenings, the movie, there was all sorts of interesting stuff about L-Dopa in that movie, and that's because L-Dopa is converted to dopamine in the central nervous system. People with Parkinson's are thought to not have enough dopamine in their brain, and so giving them the precursor for dopamine really helps them. But one of the problems is the body breaks down the levodopa before it can get into the brain. So we give them carbidopa in combination with the levodopa. The carbidopa prevents the peripheral breakdown of the levodopa. Levo stands for L, and we use L amino acids in our body for all sorts of reasons, and dopamine comes from L-tyrosine. So L is always the correct answer for which one is the precursor, and carba is always the correct answer for which one blocks the breakdown of something that's L. And so we use it in Parkinson's disease. However, there's a risk of central nervous system, CNS, agitation, chorioathetosis, hemolytic anemia, and agranulocytosis are also problems with Sinemet. It's considered a pregnancy category C drug. Let's talk about the cephalosporins. When we talk about cephalosporins, we're talking about beta-lactam antibiotics. They're related to penicillin, but they're different. But penicillin and the cephalosporins are all beta-lactam antibiotics. When we talk about cephalosporins, we divide them up into 3, or maybe 4, depending on who you talk to, 3 generations. The 3rd generation cephalosporin is used to treat mostly gram-positive organisms, gram-positive bacteria. 2nd generation cephalosporins have great gram-positive coverage, but they also treat more gram-negative bacteria. And then 3rd generation cephalosporins are really good at covering more gram-negative organisms as well. And then they consider 4th generation cephalosporins to be 3rd generation cephalosporins that cover Pseudomonas. So an example of a 1st generation cephalosporin is cephalexin, Keflex, which is an oral 1st generation cephalosporin, or cefazolin, and Cef is an IV 1st generation cephalosporin. Some commonly used 2nd generation cephalosporins are Cefaclor, C-chlor, which is available orally, Cefprozil, Cefzil, that's a PO drug, and Cefotetan, Cefotin is an IV 2nd generation cephalosporin. 3rd generation cephalosporins are ceftriaxone, Rocephin, that's available IV or IM, and cefotaxime, Clafuran, another 3rd generation cephalosporin. However, the cephalosporins have a risk of Stevens-Johnson syndrome, and there is cross-reactivity with penicillin, especially with the 1st generation cephalosporins. Somebody who is allergic to penicillin has a 10% chance of being allergic to 1st generation cephalosporin. They're considered relatively safe in pregnancy, category B drugs. Chloroquine, Aralin. Chloroquine inhibits DNA-RNA synthesis in protozoa. That's why we use it to prevent and treat malaria, and we can fight amoebic infections as well with chloroquine. However, it can cause cardiac conduction block, heart block, pancytopenia, hemolytic anemia, cause the breakdown of red blood cells, and all sorts of cytochrome P450 interactions. It's considered a category C drug. Chlorpromazine is Thorazine. So chlorpromazine is a phenothiazine dopamine antagonist, and the antipsychotics are considered dopamine antagonist. However, one of the risks with using any antipsychotic is neuroleptic malignant syndrome. It can lead to seizure disorders, atrioventricular heart conduction defects, and pancytopenia as well. It's considered a pregnancy category C drug. Cimetidine is Tagamet. Cimetidine is an H2 receptor antagonist. H2 stands for histamine. Histamine receptor type 2. These are in the stomach. Histamine stimulates gastric acid secretion in the stomach, and H2 receptors sense that, so it inhibits gastric acid secretion. So we use it in gastroesophageal reflux disease and peptic ulcer disease. However, rare risk is pancytopenia, and there's all sorts of cytochrome P450 interactions. It's pregnancy category B drug. Ciprofloxacin is Cipro. ciprofloxacin is a fluoroquinolone antibiotic, meaning it interferes with DNA gyrase in bacteria. It's available orally and IV. However, ciprofloxacin can cause Stevens-Johnson syndrome, and then any antibiotic can cause pseudomembranous enterocolitis caused by an organism, Clostridium difficile. It's pregnancy category C drug. Clonidine is catapress. And so clonidine is a central acting alpha-2 agonist. Don't confuse central acting agonists, central acting alpha agonists with alpha blockers. Alpha blockers work peripherally between the neuron and the blood vessels to lower blood pressure, but this drug works on the brain to lower blood pressure. So central alpha agonists work on the brain to decrease the sympathetic nervous system activity in the brain. That's why we use it as an antihypertensive. Actually, when we first take the clonidine, all that alpha agonism makes the blood pressure go up a little bit, but once it gets into the brain, it starts to lower the blood pressure. And they're starting to research the use of clonidine in heroin withdrawal, opioid withdrawal, and it's been used from time to time in attention deficit hyperactivity disorder. However, it can cause orthostatic hypotension. When you go from sitting down or laying down to a standing up position, you need your blood vessels to squeeze on the blood supply to help push it up into the brain. And alpha blockers and central alpha agonists can interfere with that response, so it could cause low blood pressure due from going to laying to sitting to standing. And then it's very sedative. So there's a problem with sedation, and people who take clonidine occasionally complain of headache. It's considered pregnancy category C drug. Clopidogrel is Plavix. So clopidogrel is a platelet aggregation inhibitor, and so it's commonly used to prevent blood clot formation in new stents. Stents are little wire tubes we use to hold things like coronary arteries open, and those little wire meshes can collect clots on them depending on how they make them. So commonly when somebody gets a stent, we will put them on Plavix clopidogrel to prevent thrombus formation. And it's also used to prevent the risk of myocardial infarction and stroke. However, with any platelet aggregation inhibitor, with anything that interferes with blood clotting, hemorrhage is a risk. And clopidogrel also has a risk of neutropenia, too few neutrophils. It's a pregnancy category B drug. Codeine. Codeine is an opioid analgesic used in pain control. It's also used as a cough suppressant. And a risk is oversedation. With any opioid analgesic, we can use them excessively to the point of oversedation, taking away central nervous system respiratory drive to the point of death. Addiction is a problem with all the opioid analgesics. And nausea is another problem with opioid analgesics, as well as constipation. It's pregnancy category C drug. Colchicine. Colchicine inhibits microtubule formation in leukocytes, and so it decreases phagocytosis and the inflammation in joints. So we use it as an anti-gout agent, and we also use it in pericarditis as well, more and more. But one of the risks with colchicine is kidney problems, kidney damage, and pancytopenia. It's considered unsafe in pregnancy, a category D drug. Cyclophosphamide is Cytoxan. Cyclophosphamide is an alkylating agent. So it inhibits DNA and RNA chain formation throughout the cell cycle, so it is cell cycle non-specific. So we use cyclophosphamide as cancer chemotherapy. Cyclophosphamide is based on the mustard gas that was used during World War I, a vesiccating agent causing blistering. So if we get this on the skin or it extravasates outside of the blood vessel, it can cause a lot of damage to the skin. And a risk with all the alkylating agents is hair loss, pancytopenia, bone marrow suppression, nausea, vomiting, and stomatitis. Desmopressin is DDAVP. And DDAVP is an antidiuretic hormone analog. We can use it in diabetes insipidus and nocturnal enuresis, bedwetting. Diabetes insipidus is due to too little antidiuretic hormone being made by the brain, neurogenic DI, and we can use desmopressin to replace the antidiuretic hormone. If your kidneys are not responding to antidiuretic hormone, nephrogenic DI, then desmopressin probably won't help with that. But something that desmopressin is commonly used for because of its effect on platelets, blood clotting, we use it in von Willebrand's disease to increase the activity of clotting factor number 8. Diazepam is Valium. Diazepam is a benzodiazepine, and all benzodiazepines are gamma-aminobutyric agonists, opening chloride channels on central nervous system neurons. And so by opening chloride channels, that's going to interfere with nerve conduction. And so we use it not only as an anxiolytic and as a sedative. Diazepam Valium is used to terminate seizures, and the rectal version of diazepam is Diastat, commonly kept in carts to treat seizures in people who do not have IV access. And the benzodiazepines are also essential in the withdrawal of alcohol and the treatment of delirium tremens. However, the risk of all benzodiazepines is central nervous system depression with excessive doses and hepatic insufficiency can result in the increased level of metabolites, causing more CNS depression, and addiction is a problem with all the benzodiazepines. It's considered unsafe in pregnancy, category D drug. Digoxin is Lanoxin. Digoxin is a digitalis glycoside. Glycoside meaning it's a big chain of glucoses. Digitalis comes from the foxglove plant. And so this cardiac glycoside blocks sodium-potassium pumps. And after you do all the math, this increases calcium availability. And that's why we use it as an antiarrhythmic. A positive inotrope helps the heart beat stronger. It is negatively chronotropic, meaning it slows the heart down, and it does that by slowing atrioventricular conduction, and so we use this in atrial fibrillation very commonly. However, the risk of any antiarrhythmic is more arrhythmia, and there is toxicity with digoxin and low potassium. A lot of people who are in congestive heart failure will get digoxin and Lasix. Lasix is a diuretic that lowers potassium levels, and digoxin is especially cardiotoxic with low potassium levels. So people who take digoxin and Lasix together, you will see them on potassium supplements a majority of the time. Digoxin is a pregnancy category C drug. Digoxin Immune, FAB, a type of antibody that we call Digibind. And so digoxin immune FAB is an immune globulin. Immune globulins usually stick to bacteria and viruses, so your immune system can attack them. But here, the immune globulin is going to bind to the digoxin, preventing the digoxin from working. And anything that binds to the drug to prevent the drug from working is considered a chemical antagonist. Diphenhydramine is Benadryl. Diphenhydramine is a histamine type 1 antagonist. All the H1 blockers are antihistamines, meaning they're used to treat allergies. However, diphenhydramine, just like all the old H1 antagonists, has anticholinergic properties as well. Not only does it block the H1 receptor, it can block muscarinic receptors as well. So not only can we use diphenhydramine for sleep and allergies, we also use it as an anticholinergic in Parkinson's disease, and we also use it in acute dystonic reactions caused by antipsychotic medications, dopamine antagonists, and anti-nausea medications based on the dopamine antagonists. Oh, and it's used as a sedative. I remember that. Doxycycline, vibramycin. Doxycycline is a tetracycline derivative antibiotic. It's a 30S subunit inhibitor, and so it's a ribosomal inhibitor. Interfering with the ribosome interferes with bacterial protein production. It interferes with the ribosomes and the bacteria. And so it's bacteriostatic. Static means it stops the division of the bacteria, stops the reproduction of the bacteria, and then allows the immune system to destroy the bacteria after that. Bacteriolytic means it kills the bacteria. But with doxycycline, there's a risk of pancytopenia and Stevens-Johnson syndrome. And because doxycycline causes a problem of the metabolism of calcium in the unborn child, we do not use doxycycline in pregnant women or very young children. It's considered unsafe in pregnancy, a Category D drug. Enoxaparin is Lovenox. Enoxaparin is unfractionated heparin, also known as low molecular weight heparin, and so we use it as an antithrombotic blood to prevent clotting and coagulation of the blood, and it is a drug that is given subcutaneously at Apoetin is Epigen, Procrit. Apoetin is an erythropoietin analog. It stimulates the production of erythrocytes. Apoetin comes from the kidneys to tell the blood cells, to tell the bone marrow to make more red blood cells. That's why people with renal failure are anemic, don't have enough red blood cells, because the kidneys make erythropoietin. And we can take that and make that a drug to stimulate the production of erythrocytes, and so we use it in the anemia that's due to chemotherapeutic agents and renal failure. Erythromycin is abbreviated EES. It is a macrolide antibiotic, a 50S subunit inhibitor. It's used in community-acquired pneumonia, mycoplasma pneumonia. We don't really use it in chlamydia. It's an IV and PO medication and pregnancy Category B drug. Fluconazole is diflucan. Fluconazole is an antifungal. It inhibits ergosterol synthesis. Basically, it damages fungal cell walls. It's fungistatic, meaning it prevents the reproduction of the fungus and allows your immune system to kill off the fungi. However, with fluconazole, there is a possibility of Stevens-Johnson syndrome and liver toxicity, hepatotoxicity. But it is considered relatively safe in pregnancy, Category B drug. Flumazenil is Romazicon. Flumazenil is a benzodiazepine antagonist, so it's used in benzodiazepine overdose, and it's used in anesthesia to reverse benzodiazepines. However, they have to be very careful with the use of flumazenil because we use benzodiazepines to stop seizures. Blocking benzodiazepine activity in the brain can cause seizure and will cause seizure. So excessive doses of flumazenil will cause seizure. Something else that has to be kept in mind is flumazenil has a very short half-life. Benzodiazepines have very long half-life. So the flumazenil will wear off before the benzodiazepine benzodiazepines do. And so because it has a much shorter half-life than benzodiazepines, it might require multiple doses to continue the effect. It's a pregnancy category C drug. Fluoxetine is Prozac. Fluoxetine is a selective serotonin reuptake inhibitor used in depression. It's considered a category B drug. Fondaparinux is Arixtra. Fondaparinux is a selective factor 10A inhibitor, meaning is an anticoagulant, antithrombotic. You'll see fondaparinux used for the same reasons you see Lovenox used. It's considered a pregnancy category B drug. Furosemide is Lasix. Lasix is a loop diuretic. It inhibits resorption of calcium chloride and sodium and magnesium in the ascending loop of Henle. And so that's why it's used in high volume, hypervolemic states, high blood volume states. It can be used in hypertension. It's used in congestive heart failure and pulmonary edema as well. However, there's a risk of giving too much or working too well, hypovolemia, low blood volume. And Lasix, the loop diuretics can cause hypokalemia, low potassium. So it's very important when you use Lasix and digoxin to make sure that that person is getting plenty of potassium through either supplements or the diet. Heparin. Heparin is an anticoagulant, antithrombotic that's used in deep vein thrombosis, pulmonary embolism, myocardial infarction. Heparin is monitored with a type of lab called a PTT, a partial thromboplastin time. However, there's a risk of the heparin either getting too much or working too well, so hemorrhage is one of the risks of heparin, as well as heparin-induced thrombocytopenic thrombosis syndrome. We expect heparin to thin the blood. However, some people can have an immune reaction to the heparin that causes them to form clots excessively. So don't forget about this. This is something they will ask you on boards. It's a pregnancy category C drug. Hydrochlorothiazide is abbreviated HCTZ. Hydrochlorothiazide is a thiazide diuretic. It is based on the sulfonamides as well. It acts on the distal tubule in the kidney, increasing the excretion of sodium, water, chloride, magnesium, potassium, and bicarbonate. Hydrochlorothiazide is a diuretic, increasing urination. And so because it's a sulfonamide, there is a risk of Stevens-Johnson syndrome with the use of hydrochlorothiazide. And there's a risk that we will have hypovolemia, hypokalemia, again, low potassium can be caused by the thiazide diuretics and the loop diuretics. Pancytopenia and hyperuricemia, both the loop diuretics and the thiazide diuretics can increase the formation of uric acid crystals, increasing gout attacks. It's considered a pregnancy category B drug. Ibuprofen has all sorts of names. Advil is one of them. Ibuprofen is a nonsteroidal anti-inflammatory drug preventing prostaglandin synthesis. So it's used as an analgesic, an anti-inflammatory, and an antipyretic. However, one of the risks with the nonsteroidal anti-inflammatories is gastrointestinal upset, stomach upset, and even ulceration. Blood dyscrasias, disorders of the blood, can be caused by nonsteroidal anti-inflammatories. And again, it can lead to Stevens-Johnson syndrome. Any drug can cause Stevens-Johnson syndrome. It's pregnancy category B drug. But I can assure you that your OB-GYN probably does not want you to take anything that interferes with blood clotting while you're pregnant, so be sure and ask. Imipramine is tofranil. Imipramine is a tricyclic antidepressant, meaning it is a preventer of the reuptake of norepinephrine, and so we use it in depression, bedwetting, and headache. However, There's a risk with using tricyclic antidepressants with any sympathomimetic drug or any parasympatholytic drug. Can raise blood pressure, causing hypertension, arrhythmia, and even seizure. It's a pregnancy category C drug. Insulin. Insulin comes in a rapid-acting form, a short-acting form, an intermediate-acting form, and a long-acting form. And insulins also come in mixtures of these two types. So insulin is an endogenous polypeptide made by the body, secreted by the pancreatic beta cells. Insulin is what's required to get glucose into the cells, except the brain. The brain does not need insulin to absorb glucose, but your brain does require your body to regulate glucose. Rapid-acting insulins usually start working between 15 and 30 minutes. Their peak action will be between 1/2 and 1 1/2 hours, and rapid-acting insulins can last from 3 to 4 hours before their effect is gone. Apidra, Novolog, and Humalog are commonly used rapid-acting insulins. Short-acting insulins, regular insulins, they usually start working from 1/2 hour to 1 1/2 hours. Their action will peak from 2 to 3 hours, and they generally last anywhere from 3 to 6 hours. So Humulin R, Novolin R, the R stands for regular, which is a short-acting insulin. Please do not confuse rapid-acting insulins with short-acting insulins. I can assure you they will try to confuse you on the boards when you see those questions. Intermediate-acting insulins usually start working after 2 to 4 hours. Their peak action is from 6 to 12 hours later, and they can last anywhere from 10 to 18 hours. So with intermediate-acting insulins, the blood glucose is affected 12 hours later. That means somebody who uses an intermediate-acting insulin, the dose they give themselves in the morning controls the evening sugar levels, and the dose they give themselves in the evening controls the morning sugar levels. And so if somebody's glucose levels in the morning are abnormal, we will adjust their evening intermediate insulin. And if somebody's evening glucose levels are abnormal, we will adjust their intermediate acting insulin that they give themselves in the morning. And that's an enormous source of confusion for a lot of people. NPH, Novolin N, Humulin N, and Lente, these are all intermediate acting insulins. And then there's the long-acting insulins. They take 6 to 10 hours to start working. The peak effect is anywhere from 6 to 12 hours, and they can last anywhere from 18 to over 24 hours. Ultralente and Lantus are popularly used long-acting insulins that can be given once a day in the evening. However, there's the risk of the insulin working too well or getting too much, ending up with hypoglycemia. Insulin is considered a pregnancy category C drug. Interferons are naturally occurring substances used by the body to interfere with DNA and RNA replication in viruses. And there's all sorts of interferons out there. Interferon alpha, interferon beta, interferon gamma. Interferons can be used to not only treat viral infections, treat certain kinds of cancers as well. Ipratropium is Atrovent. Ipratropium, be sure and see that atropine-looking word in ipratropium. Ipratropium is an anticholinergic that we use as a bronchodilator. And so anticholinergics block acetylcholine at muscarinic receptors. So ipratropium is used in asthma. And so we can use anticholinergics to bronchodilate. We can also use sympathomimetic beta agonists like Ventolin, albuterol as well. And the combination of ipratropium and albuterol is called Combivent. We can use both drugs in the treatment of asthma. Isoniazid is INH. Isoniazid inhibits RNA synthesis, and so we use it as an antibiotic in tuberculosis. However, with the use of INH isoniazid, we need to monitor liver function because isoniazid can cause hepatotoxicity. Levothyroxine is Synthroid. Levothyroxine we use as a thyroid replacement hormone in hypothyroid states, and is the only drug that I know of that's considered a Category A drug. Lidocaine. Lidocaine is a sodium channel blocker in neurons, and it also blocks sodium channels in heart muscle. So we can use it as not only as a local anesthetic, but we can also use it as an antiarrhythmic. We use it in the treatment of ventricular tach, pulseless ventricular tach, and ventricular fibrillation, and we can also use it in digitalis toxicity as well. Lithium, carbolith, escalith, duralith, lithinate. Lithium has all sorts of names. Lithium is a salt alkali metal ion. It's on the periodic table. It's under sodium on the periodic table. It's thought to interfere with sodium permeability in neurons, depending on what you read. And so we use it in bipolar disorder. It's considered an anti-manic, and we can also use it as an antipsychotic. Because it causes diabetes insipidus, which is why people on lithium require constant monitoring. Because it causes diabetes insipidus, we can use it to treat exactly the opposite of diabetes insipidus, syndrome of inappropriate antidiuretic hormone. And however, lithium can cause diabetes insipidus at the kidney, nephrogenic DI. It's considered unsafe in pregnancy, a Category D drug. Losartan is Cozar. Losartan, like all the drugs whose generic names end in sartan, are angiotensin II receptor blockers. Remember, we used ACE inhibitors to prevent the formation of angiotensin II. We can use angiotensin II receptor blockers, ARBs, to prevent angiotensin II from constricting blood vessels and raising blood pressure. That's why ARBs are used to treat blood pressure, high blood pressure. But just like the ACE inhibitors, they're considered unsafe in pregnancy to the unborn child. They're considered pregnancy Category D drugs after the second trimester. Lovastatin is Mevacor. Lovastatin, like all the statins, are HMG-CoA reductase inhibitors. HMG-CoA reductase is required in the formation of cholesterol, and that's why all the statins can be used to prevent the formation of cholesterol, lower cholesterol. That's why it's used in hypercholesterolemia, hyperlipidemia as well. But all the statins are absolutely contraindicated in pregnancy. They are Category X drugs. However, with the use of statins, there's always a risk of muscle pain and rhabdomyolysis, muscle breakdown to the point of clogging and disrupting kidney function. Meperidine is Demerol. Meperidine is an opioid analgesic used in pain control. However, with all the opioid analgesics, the potential for respiratory depression is high, as well as addiction, and we want to be very careful with use of meperidine in people who have a hepatic insufficiency. It's considered a pregnancy Category C drug. Metformin is glucophage. Metformin, glucophage, is a biguanide that inhibits liver formation of glucose, and it also increases peripheral sensitivity to insulin. That's why we use metformin commonly in type 2 diabetes mellitus. It's considered a pregnancy Category B drug. Metformin is that drug that can cause lactic acidosis. People who are getting radiologic contrast scans who are on metformin, we will stop the metformin, check for kidney function. If the kidney function is okay, we will proceed with the radiologic study that requires contrast because many of the contrasts interfere with kidney function. After the contrast study is over, we'll check kidney function again, and if kidney function is okay, we will start metformin. So anybody who gets an x-ray where IV contrast is involved, we will stop the metformin, make sure kidney function is okay through the study before we start metformin again. Methotrexate is an anti-metabolite, anti-neoplastic. It inhibits enzymes that use folic acid to make nucleic acids, and so it's considered cell cycle specific for the S phase. We can use it as an anti-neoplastic, we can use it as cancer chemotherapy, and we can also use it as immune suppressant in rheumatoid arthritis. However, pancytopenia is a risk with methotrexate, as well as seizures, hepatotoxicity, renal failure as well. Methotrexate is absolutely contraindicated in pregnancy, a Category X drug. Miconazole is Monistat. Miconazole is an azole antifungal. It binds to cell sterol. Sterols are related to cholesterol. Fungus use sterols to make their cell walls, and miconazole can lead to the breakdown of the cell wall. However, there is a risk of hyperlipidemia with the use of azole antifungals. It is a pregnancy Category C drug. Morphine. Morphine is the prototypical opioid analgesic named after the god Morpheus, the god of dreams. And with all opioid analgesics, there is a risk of addiction and central nervous system depression with excessive doses, as well as nausea, vomiting, and constipation. Morphine is a pregnancy Category C drug. Naloxone is Narcan. Naloxone is an opioid antagonist, and it is the antidote for opioid overdose. And so many people who come to the emergency room who are unconscious, it will be protocol to give them some naloxone, Narcan, because many people who come to the emergency room unconscious have overdosed on opioids like heroin. So many emergency rooms, especially in the urban inner city areas, anyone who comes through the door unconscious will receive a dose of Narcan because it's relatively safe and it works immediately. It's considered a pregnancy Category B drug. Nitroglycerin. And nitroglycerin is a nitrate. It dilates smooth muscle. It relaxes smooth muscle, so it's a vasodilator. And this decreases vascular resistance. This also decreases the preload and the afterload on the heart. The preload is the volume after you've done all the calculus. The preload is the volume of blood in the heart before it contracts. The afterload is the volume of blood in the heart after contraction. And so nitroglycerin is commonly used in coronary artery disease. People who have angina, chest pain due to coronary artery disease will take nitroglycerin, sublingual nitroglycerin under the tongue to vasodilate and improve blood flow to the heart. And so stable angina is a good reason to use nitroglycerin. Nitroglycerin can also be taken, a different form of nitroglycerin can be taken on a daily basis to prevent angina caused by coronary artery disease. And then we can use it emergently in someone who has malignant hypertension, someone whose blood pressure is so high that it's starting to cause brain and organ damage. Nitroglycerin is a great way to lower blood pressure very quickly, and something to keep in mind when you give nitroglycerin to anyone, because it will cause hypotension. That's why they tell you to, before you give anyone nitroglycerin, they should be sitting down in a comfortable position. They should not be up walking around. They should be sitting down in a comfortable position, ready to lay down if necessary, because it can cause hypotension. It's considered a pregnancy Category C drug. Oxytocin is Pitocin. It's a naturally occurring polypeptide hormone from the posterior pituitary. and it's used to stimulate labor and delivery of babies, as well as milk let down from the mammary glands. However, the use can result in seizures, tetany, a certain kind of muscle spasm, and then with any kind of anything that stimulates uterine contraction, it can shut off blood supply to the uterus, causing uterine ischemia. Phenobarbital is phenobarb. Phenobarbital is a barbiturate, a barbiturate, and it is a gamma-aminobutyric acid agonist. Now, benzodiazepines like Valium are also GABA agonists, but barbiturates have their own receptor site, different from GABA and different from benzodiazepines on the chloride channel. So phenobarbital and all barbiturates open chloride channels on central nervous system neurons, and this opening of the chloride channel offsets opening sodium channels. Because sodium is positively charged, opening sodium channels on neurons excites the neuron. So opening chloride channels prevents the neuron from being excited, and this is why we can use phenobarbital to treat things like seizure. We can use barbiturates to treat seizures. We can use barbiturates as sedatives, things to put people to sleep, things to drugs that can be relaxing. And like any drug, there's a risk of Stevens-Johnson syndrome, thrombophlebitis, clots, little blood clots in the veins, and angioedema, swelling. It's considered relatively unsafe in pregnancy, a Category D drug. Phenytoin is dilantin. Phenytoin is a hydantoin anticonvulsant. It's a sodium channel blocker. And by blocking sodium channels, we can use it to not only prevent but treat seizures. However, one of the risks of using phenytoin is cardiac arrhythmia, fetal hydantoin syndrome. Women who take phenytoin while they're pregnant can have a certain type of birth abnormality in the child called fetal hydantoin syndrome. Stevens-Johnson syndrome is another potential possibility. Pancytopenia, meaning the bone marrow does not make all the cells it's supposed to, and a lupus erythematosus-like reaction. Something else to keep in mind about phenytoin is when you give it IV, it can cause hypotension. So phenytoin must be given very slowly. And it's considered relatively unsafe in pregnancy, a Category D drug. Prazosin is Minipress, and it is a alpha adrenergic blocker, a peripheral alpha blocker. It's an antihypertensive, and it lowers blood pressure, also decreases cardiac preload and afterload. Alpha blockers can also be used to treat benign prostatic hypertrophy, a difficulty urinating due to large prostate. One of the problems with all the alpha blockers is something called orthostatic hypotension. If we go from laying to sitting to standing, or from sitting to standing, that reflex that squeezes on the blood vessels, keeping the blood flowing up into your brain, this blocks that, and so people who take alpha blockers can have orthostatic hypotension, where their blood pressure drops low when they go from laying to sitting and from sitting to standing. And there can be central nervous system effects with alpha blockers as well. It's considered a pregnancy Category C drug. Prednisone. Prednisone has all sorts of names. Prednisone is a glucocorticoid. It is a synthetic prodrug that's converted to prednisolone. Hydrocortisone is a naturally occurring glucocorticoid that comes from the adrenal cortex, and it's used. The body uses it in times of stress for glucose regulation and all sorts of cellular regulation. And so we use prednisone to treat any kind of inflammatory disease like asthma, rheumatoid arthritis. People who have Addison's disease have hypoadrenalism. Their adrenal cortex does not make enough glucocorticoids, and so prednisone is a glucocorticoid we can use in Addison's disease as well. However, the risks of using excessive amounts of prednisone is Cushing's syndrome, and immunosuppression is also a potential problem with prednisone. People who take prednisone on a regular basis, that'll cause their white blood cells levels to go up due to something called margination, and prednisone causes gluconeogenesis, meaning people who take prednisone, they'll have elevated glucose levels when we check them. It's considered a pregnancy category C drug. Procainamide is Procanbid. Keeps hanging out on our slideshow. It is a class 1A antiarrhythmic. All the class 1 antiarrhythmics are sodium channel blockers, and we use procainamide in arrhythmia, ventricular fibrillation, ventricular tachycardia, and PVCs, premature ventricular complexes. But pancytopenia and atrioventricular heart block are potential problems with procainamide. It's considered a pregnancy category C drug. Progesterone. Progesterone is a naturally occurring reproductive steroid hormone. It inhibits pituitary secretion of gonadotropins, preventing follicular maturation and ovulation. It stimulates the growth of mammary tissues, and it also has anti-neoplastic action against endometrial cancer. So we can use it in birth control pills to prevent conception. We can use it to treat amenorrhea, depending on the reason for their amenorrhea. However, the use of birth control pills and progesterone thromboembolism, especially in people who smoke, they can get blood clots, especially in deep veins in their legs, and those can break loose and go into the lungs. Considered pregnancy category D drug. Propranolol is Inderal. Propranolol is a non-cardioselective beta-adrenergic antagonist. Propranolol is a beta blocker, and so we use it for hypertension. We can also use it in congestive heart failure. We can use it as an antiarrhythmic. But since it's not cardioselective, there's a higher risk of bronchospasm using propranolol. There's always a higher risk of using bronchospasm with non-cardioselective beta blockers than there is with cardioselective beta blockers. But even cardioselective beta blockers can cause bronchospasm, so don't be fooled. Sometimes people use beta blockers in their eye drops to treat glaucoma and elevated pressure in the eyes. And they will even use cardioselective beta blockers in these eye drops to prevent bronchospasm in people who use the eye drops. Something else we can use propranolol for is essential tremor. People who have tremor, it kind of looks like Parkinson's, but they don't think it's due quite to Parkinson's. Essential tremor, people can take propranolol for that, and that works pretty well. Headache is another reason some people take propranolol. Some people have anxiety so bad that when they stand in front of a group to speak or end up in any kind of anxious situation, their heart pounds so hard, they have such an intense adrenaline rush that they can't cope. Propranolol is actually very good at preventing that. And so that's one of the reasons we use it as an anxiolytic. Something else propranolol can be used for is something called thyroid storm. When thyroid levels are dangerously high, this can cause the heartbeat to beat very rapidly, tachycardia, and so we can use propranolol for that as well. However, a therapeutic extension of propranolol, it working too well, or we give too much, low blood pressure. And then with any beta blocker, bronchospasm is a potential problem, and so we've got to be very careful using beta blockers in people with asthma. Pancytopenia is a rare risk with propranolol. It's considered a pregnancy category C drug. Tamoxifen is Nolvadex. It is an neoplastic anti-estrogen hormone. It's a drug used in breast cancer. It can be used to prevent breast cancer as well. Certain people who are very high risk for breast cancer, we can put them on tamoxifen as a prophylactic drug. However, with any of the progesterones and estrogens, there is a risk of thromboembolism, especially if they're used when smoking. And pancytopenia is another risk with tamoxifen. It's considered a pregnancy category D drug. Testosterone, it also comes in a topical form. They call that androderm. Testosterone is a naturally occurring reproductive steroid hormone. It's an anabolic steroid hormone. All the steroid hormones are synthesized from cholesterol, and anabolic means it is something that builds, something that helps metabolize and build things. And so testosterone is responsible for male secondary characteristics. It's used for euphemism when the testicles are either not present or not functioning. Osteoporosis is a use for testosterone. They use it in people with HIV, AIDS, and their weight loss, and we can use it to speed up male puberty. Theophylline is Theodore. Theophylline is a xanthine. It's a phosphodiesterase inhibitor. Phosphodiesterase breaks down cyclic AMP. Cyclic AMP is a second messenger. And so adenylyl cyclase increases the levels of cyclic AMP. Phosphodiesterase breaks cyclic AMP down. So caffeine is a phosphodiesterase inhibitor. That's why it gives us that uppity feeling, because epinephrine raises cyclic AMP levels by activating adenylyl cyclase, and caffeine keeps cyclic AMP high by preventing its breakdown, because caffeine is a phosphodiesterase inhibitor. Theophylline, which is used to relax bronchial smooth muscle, used to treat COPD and asthma, is also a xanthine phosphodiesterase inhibitor. Works the same way caffeine does. It prevents the breakdown of cyclic AMP, although I don't think theophylline has all that central nervous system effect. But it is used to relax bronchial smooth muscles, so we use it in COPD and asthma. The risks of using theophylline are creating an abnormal heart rhythm, arrhythmia. It's considered pregnancy category C drug. Vasopressin is anti-diuretic hormone. Vasopressin is a naturally occurring polypeptide hormone from the posterior pituitary. It stimulates the kidneys to reabsorb water. It helps the kidneys prevent water loss. That's why it's called anti-diuretic. It prevents diuresis. It prevents urination by causing the kidneys to retain free water rather than urinate the free water out. It is also used as a vasoconstrictor. And so it's used in central diabetes insipidus. Diabetes insipidus has two forms. A central form, meaning it's caused by the brain not making enough vasopressin, and so replacing the vasopressin that the brain does not make is a good reason to use vasopressin. However, there's nephrogenic diabetes insipidus. That means the kidneys do not respond to vasopressin, and that's why vasopressin is used in cases where the brain is not making vasopressin. Vasopressin is not used so much when the kidneys are not responding to it. Something we used vasopressin for in this class is our advanced cardiac life support algorithm to treat pulseless ventricular tachycardia and ventricular fibrillation. Verapamil is also known as Kalan. Verapamil is a calcium channel blocker. It's a type of calcium channel blocker called a diphenylalkylamine. It slows calcium influx into the cardiac muscles and the smooth muscles of the blood vessels as well. It's used to treat hypertension. We can also use it to treat various arrhythmias like supraventricular tachycardia, and we can use it to treat angina. However, the risks of the verapamil, its therapeutic extension, either they get too much or it works too well. Hypotension, low blood pressure. Of course, Stevens-Johnson syndrome. It's a pregnancy category C drug. Vincristine. Vincristine is an anti-neoplastic vinca alkaloid. It inhibits RNA synthesis and mitosis, so it's cell cycle specific for the M phase of the cell cycle, and so it's used in cancer chemotherapy. Alopecia, which means hair loss, nausea and vomiting, pancytopenia, seizures. These are all risks with using vincristine. It's a pregnancy category D drug. And I think this is the last one on this list. Warfarin is Coumadin. It is an antithrombotic, anticoagulant. It prevents the liver synthesis of vitamin K dependent factors 2, 7, 9, and 10 for those of you keeping score. Warfarin is mostly available orally. There's an IV form, which I've never heard of or seen anyone use. Warfarin is an oral medication that we use to prevent strokes in people with atrial fibrillation, prevent blood clots in people who are at risk for deep vein thrombosis and pulmonary embolism. But because it stops the factory that makes proteins, it takes several days for warfarin to work. So the warfarin that you take today takes several days to start working, anywhere from 3 to 7 days. We check the effectiveness of the use of warfarin by getting PTT, a PT-INR, which is a type of lab test to check how well the warfarin is working. So we use that as an anticoagulant. Oh, I knew I was looking for this slide right here. So the effect occurs several days after dosing. The warfarin that's taken today takes several days to work, and the effect is checked with a PT-INR. Do not confuse that with the PTT that we use to check heparin. And so because it interferes with the production of vitamin K dependent proteins, then we reverse the effects of warfarin with vitamin K aquamaphytin. So you might see somebody getting vitamin K sometime before surgery to help the liver synthesize more vitamin K dependent clotting factors. However, the risks of using warfarin is working too well and getting too much. Its therapeutic extension, hemorrhage, bleeding too much. Warfarin is absolutely contraindicated in pregnancy. It is a category X drug. Well, we will stop that set of slides.
This is Cable 55, UH Maui College Television Network.